Hi, Tina. Nice to meet you online or via video. My name is Lindsay Frank. I'm the one who spoke with you today, your new ARMS worker if you choose to work with us from Reach for Resources. So as you had asked, I am here to read through, and I thought it'd be helpful if I gave you a video, so that way you have the audio information as well as the you can read along. So I'm just gonna highlight as I go. So client information and ARMS policy statement. Welcome. Reach would like to welcome you to take this opportunity to acquaint you with information relevant to adult rehabilitative mental health services, or ARMS, ARMHS, confidentiality and journal policies. Your ARMS worker will answer any questions you have regarding any of these policies. Aims and goals. ARMS is a mental health service. ARMS is a mental health service which are rehabilitative and enable you to develop and enhance psychiatric stability, social competencies, personal and emotional adjustment, and independent living and community skills when these abilities are impaired by the symptoms of your mental illness. Adults rehabilitative mental health services are also appropriate when provided to enable you to retain stability and functioning if you would be at risk of significant functional decompensation or more restrictive service settings without these services, such as an inpatient hospital. Adult rehabilitative mental health services instruct, assist, and support you in areas such as interpersonal communication skills. So that would be like speaking with, doing your taxes or speaking with an employer or another service worker or healthcare worker. Community resource utilization and integration skills, which I know you said you were quite resourceful. Crisis assistance, relapse prevention skills, healthcare directives, budgeting, shopping skills, healthy lifestyle skills and practices, cooking and nutrition skills, transportation skills, medication, education, and monitoring, mental illness symptom management skills, household management skills, employment-related skills, and transition to community living services. This is a major this is the major aim, goals, and also the basic definition of what ARMS is. So usually ARMS appointments, the ARMS program expects individuals to meet with their ARMS worker at least one time a week for 2 hours. This can change at the beginning if we only meet for, twice for 1 hour a piece. That's okay since it is virtual and it can be harder to have a 2-hour-long conversation with somebody on the phone. Okay, so back to the ARMS program expects individuals to meet with their ARMS worker at least one time a week for 2 hours. It is recommended that individuals, especially when new to the program, meet twice weekly for a total of 4 to 6 hours. Again, this is usually more feasible when I'm able to come out to your home and to visit you. It is harder since we're doing it all by phone or video, whatever you're comfortable with at first. So usually I'm offering people to meet and talk for about an hour, 2 or 3 times a week just to check in since we cannot come to your home. To remain active in the program, individuals must maintain consistency of 2-hour weekly appointments. Again, if there are issues that arise, feel free to speak with me. We don't try to kick out people unless it really just is not working. If you have to cancel, there's a no-show. We understand that sometimes mental health issues and bad days can get in the way, and that's one of the things that we're working to prevent. Your ARMS worker is available by phone during regular business hours. I'm usually available until 8 p.m. I'm working a little bit late tonight, but that's okay. In the event of an after-hours emergency, we recommend you call Community Outreach Psychiatric Emergencies, or COPE, and the number 612-596-1223, or dial 911. Again, that's only an emergency. Otherwise, you feel free to reach out to me. As this is a volunteer service, you may discontinue ARMS at any time, but please discuss any decisions with your ARMS worker, the ARMS treatment director, or the clinical supervisor. All right, and that's all I'm going to read for now. This goes into confidentiality, letting you know that everything you share with us is confidential. It is safe under your the health Privacy and Information Act. And then we talk about, this is just explaining how consultation can work. So your ARMHS worker, so myself, will consult regularly other professionals regarding their clients. This is usually a therapist, case manager, case worker, or your psychiatrist or your primary care doctor. However, the client's identity remains completely anonymous and confidentiality is fully maintained. What that means is we use encryption, so that way if emails are accidentally read, they're not readable, so that way your information stays private and it is safe. Okay, and this just goes on to talk about, I won't read the rest of this. This is just the policy saying that it is that we usually contact with email, cell phone, and sometimes fax. Usually I use email and my cell phone. So this again is just kind of talking about, this is more information about ARMHS. We don't need to go over this right now. If you do decide to go with ARMHS, then I will go through this in detail with you. But really the major point of what I wanted to record is this part saying, welcome, Reach would like to welcome you and take this opportunity to acquaint you with information. Okay, I hope this was helpful. Please feel free to read over it as many times as you want, or listen to this video as many times as you want. And if you have any questions, feel free to contact me. Thank you.